Good afternoon and welcome to our 2022 General Assembly webinar and review. My name is Emily Griffey and I'm the Chief Policy Officer at Voices, and I'm joined today by Allison Gilbreath, our Policy and Programs Director. We're going to be going through some of the results in the legislative session so far to date. There's still more to come this year. We are with Voices for Virginia's Children, and we are the statewide multi-issue advocacy organization committed to helping children and youth and families. We believe in equitable access and opportunities for all children, and we advocate for sound policies. We use data to determine unmet needs, and we lead with a goal of closing systemic gaps that fail children, that prioritize racial justice, and ensure every voice has a role in shaping the future. You can find more about us in the General Assembly session this year on our website at vakids.org. And I shift things over to Allison.
So the legislative session concluded this year without completing budget negotiations, and that has significant impacts for children and families across the Commonwealth. Because, for example, a lot of local school boards and city councils are usually using this time to complete their budgets, but those conversations can't take place until the work at the state level is done. The governor has called for a special session for April 4th, hoping to complete budget negotiations and final bills in conference. If that doesn't happen, we are hopeful that a conversation will start at least on April 4th, and as always scheduled, reconvene session will take place on April 28th. Governor Youngkin will address amendments and changes to the budget. And so we have our fingers crossed that hopefully members of the General Assembly will have everything worked out by then at the latest. This is why right now your advocacy is ever more important. There's still time to take action and send a message to legislators on our budget priorities for early childhood, mental health, foster care, and food access. You can find our action alerts on vakids.org/take action. These action alerts will signal to members of the General Assembly what children and families need in Virginia. Currently, there are budget conferees who are making the big decisions. Those are listed below. These members are selected from the Senate and the House that serve on the money committees. And even if one of these members isn't your legislator, you can still contact them and let them know what your budget priorities are. If they're a budget conferee, they start to represent everyone in Virginia because they have so much power at this point to shape the budget. However, if they are one of your members that represent your area, it's even more important that you can flag that in your email and let them know, hey, I'm a constituent, and these are the priorities that I have for children.
The biggest sticking point for these budget negotiators are around tax policies and the budget revenue surpluses that Virginia has experienced. We're really fortunate to be in a strong budget position where there is a $13 billion and growing surplus for legislators to consider what goes into the budget. So right now they are considering weighing what tax relief is provided to Virginia families, Virginia businesses, and balancing that with what needs to go into the budget for long-term expenses. That's why we look at this conversation somewhat about relief, providing families relief versus ongoing revenue to fund our programs. There's been a number of conversations and questions in terms of the budget negotiators' differences about which families, what steps in the process deserve to produce refunds and tax relief for families. There's options for one-time tax relief with the current budget year's surpluses that would just be available for 1 year, as well as options for ongoing tax relief that would be available in future budget years. Those options are somewhat in conflict, a conflict around a refundable earned income tax credit the EITC, and doubling the standard deduction, because there are some lower income families who benefit from the earned income tax credit. We support that approach as providing the most equitable resources to families and ensuring that low income families who pay a disproportionate share of their earnings in taxes are provided with the tax relief they need. Overall, one theme that we've heard from legislators is that with these options on the table, they would like some more time to consider how these options between providing tax relief and ongoing revenue impact Virginia's budget into the long term, and why our tax system may be upside down and requiring more payments from those lowest income families. So they have indicated they would like these conversations to continue to review these issues and create some recommendations potentially for the next General Assembly session, and that they would probably form some kind of work group to continue to work on these issues over the summer, using the language that they intend to get it right. So we imagine many of those budget negotiators that Allison shared with you earlier are going to have to work over the next month or so to create some short-term solutions, and that they will be working in over the summer to keep revising some of these tax policy conversations that we've been having at the beginning of 2022 and this legislative session. I'm sharing here some information from one of our great resources in Virginia, the Virginia Public Access Project, also called VPAP. They provide these data visualizations on what legislation passed this year. So I thought these two were interesting here that show which bills passed this General Assembly session, how many were introduced. We had a large number of bills introduced, over 2,200, and about 40% of those passed this year, which was, as you can see on the right, similar to what has happened in the past when we've had a divided government, divided representation of the parties between the House and the Senate. At about 40% of bills typically passed. It was the most recent two legislative sessions that folks may remember of 2020 and 2021 that had a single party control in the House, Senate, and the governor's office that produced more bills passing. And something of note here is these 45 bills in purple right here that are still in conference, that are still being negotiated between the House and Senate in the legislative overtime. Some of them are in conference because they have budget implications and have not been able to be passed until the final budget is determined. VPAP also has some data on those 50-some bills in conference right here. The major areas, you can see some areas of similarities and sticking points. Highlighted that foster care got its own tab here because two of the bills that are related to improving foster care had outstanding budget requests, and so had not moved forward at this time. There's also a number of areas in education, particularly around school construction financing, that remain unsettled as well. I'm going to ask Allison to go into more detail on this foster care bill.
Right. So this year we had a couple of bills that we had the opportunity to work on. Something that Voices has been working on improving in Virginia is kinship care. We made headway on one bill and we stalled out on two others. The first bill is Senate Bill 307. This bill gives the right for relatives to appeal if they are denied placement of their relative child. There are some cases where the denial made sense, it was the right decision. And then there are other times where it's definitely been a bit more gray. They've contacted organizations like myself or Virginia Poverty Law Center. We've reviewed it and said, actually, I'm not really sure you should have been denied. So this legislation gives the right for kinship caregivers to appeal and the right to be notified of their rights to appeal. Two bills that did not pass, but we're hopeful to bring back in the future. The first one is Senate Bill 56 with the foster care prevention program. This was heavily around putting wraparound supports for kinship caregivers who are stepping in when a child would have entered foster care, but instead are being diverted into relative care. This bill really didn't pass in part because of the budgetary impact. and it was his first time being introduced to members. There was great discussion around this bill, and I believe with some work behind the scenes over the summer and in the fall, we'll be in a better place to bring this bill back around next year. And then there were several barrier crime bills, but the one that I'm focusing on is rolling back some of the barrier crimes to become a foster parent. Unfortunately, that bill died on the House side. There were still some unanswered questions from members, and I'm hoping that we can do some work in the off season. There is a work group established to work on barrier crimes as it relates to child welfare. We also worked on some unaccompanied youth legislation this year. This is when young people do not have stable housing, but they also are unaccompanied. Right now in Virginia, youth that fit into this definition cannot be served by a shelter because it is against state law. House Bill 717 takes that barrier away. The caveat to this bill passing is currently we would only be able to use would only be able to use publicly funded shelters. This does create a much smaller pool of opportunities for young people. And so we're hoping to be able to go back next legislative session and expand upon this bill. House Bill 717 also establishes a work group to study medical services for youth in this population. Many unaccompanied youth are far behind on medical care or sometimes need dental work or something like that. And so we want to be able to provide those services. So also what Emily had just spoken to too, there were two bills that we worked on. They technically passed, but we're waiting for the budget reconciliation to see if they'll get the final go ahead. The first bill is House Bill 349. This would allow temporary housing for 6 months for those who opt out of fostering futures. There's a large group of youth who opt out immediately when they turn 18 and out of extended foster care, in part because of trauma. And this would allow for some buffer for those young people who after 6 months would then have to choose if they want to opt into fostering futures. And then House Bill 653 is a really great bill as well. It would require localities to collaborate on placements for children. This is something that a lot of private folks have worked to advocate for over the last several years, and we think would be in the best interest of children who might be placed out far from their home community when they could be maybe just across the road in a neighboring community. So to be determined on those two bills. And then we move into some of the budgetary items to be determined in child welfare. Some of these were included in one proposed budget, but not the other. iFosterCare portal would allow an app to be developed in Virginia for current youth that are in foster care, but also youth who have aged out, to be able to access everything that is available to them in one easy to use app. This was included in the House proposed budget, but not the Senate. Another budget item is the Virginia Community College Great Expectations program. This would add $500,000 to programs to be able to support the coaches that are on campus for youth who have aged out of foster care who are now pursuing their post-secondary education. This was in the Senate budget, but not the House. The next three items were included in the governor's original proposed budget, but we will wait to see if they will be kept once we get that final budget. So there's a staff salary increase for state employees. We really think this is great because the child welfare infrastructure has been an issue in Virginia for a long time. And so this will help us to continue to lift up those salaries of caseworkers. A really exciting development is the replacement of our child welfare data system that was included in the governor's budget. And we do feel pretty confident that that will stay in place. And there is some money to provide some staffing positions for the Family First Prevention Services Act. And that was the last thing on that slide, Emily. So if you want to go ahead and jump into early childhood.
Thanks. Sorry, I was trying to find a reaction button to celebrate some of those things, and it didn't work in my screen sharing, so I moved ahead too quickly. So wanted to give folks a chance to admire adorable Ella Grace here, who will be 1 on Monday, Allison's daughter. And so happy birthday to Ella, and share some of the good news that happened during the legislative session around early childhood education. There are 3 bills that did pass this year, bipartisan support. The first from Senator Favola is a bill that permits rental agreements to allow for licensed and regulated childcare programs to operate in apartments and other rental units. This just clarifies that if you are a renter, you can also be a business owner of a childcare program and serve as a family day home or registered family day home. So really encouraged to send this positive message to childcare providers who do live in rental units that they can also operate these businesses, and hope that others will consider these opportunities. The second is from Delegate David Bulova to establish regional entities for early education. These are known as the Ready Regions that have been rolling out across the state, and some technical changes to add a reserve fund for any child care overpayments. The third is a bill that will ask the Board of Education to determine the feasibility of allowing active duty members of the armed forces to have eligibility for the child care subsidy program. The bill itself does not prompt or require the eligibility, but it asks the Department of Education to look into that in the future. One provision that was stalled around this year was allowing a provisional employment for childcare staff who were pending their background check from the DSS Central Registry. That did not move forward this year, so we have the same background check requirements that have been in place previously in Virginia, and hope that while this effort would have addressed what we hoped would have been some of the staffing shortages right now and abilities to hire staff more faster internally, we do have a promise from the Department of Social Services that they will continue to look at these business processes and hope that they can provide some faster processes in the future. As with all the areas in early childhood, the budget items are still to be determined. The items that we are paying attention to, where there is some disagreement between the House and the Senate, are the overall budget allocations per pupil for the Virginia Preschool Initiative, including the per pupil increase and the flexibility to serve 3-year-olds into the future by adding some additional resources there. There's also cuts to the expansion of the mixed delivery preschool grant from the Virginia Child Care Foundation, not the base amount, but what would have been the expansion in the future. We're waiting for the final language on child care subsidy, as well as additional federal resources from the American Rescue Plan for a proposal for the Southwest Virginia community to vamp up some of their child care programs, and for the 21st Century out of school time programs as well. So these are some of the areas that we're still waiting final allocations. What looks promising is the additional $5 million a year for the early educator scholarship incentive bonus, as well as that additional flexibility for child care subsidy participation that we've had over the last year, since last April 2021, where it expands the income eligibilities much higher to 85% of state median income for families with children under 5. And that's for as long as we have these additional federal resources for child care subsidy from the Child Care Block Grant coming to play in Virginia. So those pieces do look promising even without a final budget. In terms of healthcare access, again, it's a mixed picture here of some progress and some items that were stalled. One item that moved forward that we called a little bill that could is to ensure language access and accessibility for state communication around Medicaid coverage, This is really important because there will be a number of communications about Medicaid coverage this year as we get to the end of the public health emergency in the coming months, and families will have to redetermine their eligibility for Medicaid and FAMUS. So we're glad that this bill passed that will require all the communication about Medicaid enrollment to be and interpreted into different language and to be accessible for those in the deaf and hard of hearing community. One area that's stalled is the proposal that we've called Cover All Kids that would provide health insurance to undocumented children in Virginia. It did not pass in the House or the Senate, but the Senate did ask for it to be studied over the summer and continued so they could work on this issue. We know we'll never get to a full all children covered or all children insured in Virginia until we're able to reach undocumented children as well in our population that are enrolled. And as I mentioned, to pay attention to, in the coming months, you'll hear a lot more about unwinding and the end of the public health emergency. We do not have a date for that yet, but we know, generally speaking, that it will be coming soon. And what that means is all families who have been enrolled in Medicaid and FAMUS, or pregnant women who got enrolled in Medicaid or FAMUS during the pandemic are now going to be asked in the next 12 months to provide their income eligibility and verifications so that they can be enrolled. That's always typically sometimes a difficult point for families, particularly those who may be moving, transient, have language concerns. So we really want everyone to be paying attention to this, to be aware that materials are coming out that will help families make sure they get through the redetermination process easily, and that we can keep as many of the almost 2 million now members of Medicaid and FAMUS on the rolls as possible, so we can have some continuous health insurance coverage for all who need it. Another area where there is a lot of items to be determined is around our school funding and school funding formulas. We just included some of the support positions here on this slide, but there's also still ongoing negotiations around the salary increases for teachers, as well as I mentioned earlier, school construction financing, and what is allowed for schools to take those steps in this process. We know in Virginia that schools are one of the long-time underfunded resources, public schools, and so we're advocating for as many resources as possible, and that when those decisions are made about the balance between revenue and relief, that we're definitely not shortchanging our school systems, our health systems, our mental health systems, or anything in those equations as well. So these positions were all identified as needed and necessary by either the House or the Senate in the budget this year. Reading specialists, principals and assistance principals, instructors for English language learners, the at-risk add-on for lower income schools and with serving higher poverty populations, and the support gap for all support personnel in school. The Senate also passed a bill to increase the specialized support positions per student, and those specialized support positions are the social workers, psychologists, school nurses, and others who provide those specialized health and mental health supports in schools. We know this will be an area of a lot of discussion between those budget negotiators, and so hope you will speak to your members, speak to your school board and local counties and cities about what is needed for school funding in 2022.
So these are some other interesting bills that we paid attention to this legislative session that were kid focused, about oversight and leadership changes. So House Bill 1188 was interesting because it started out with a bill that would put one non-voting student on the Board of Education or local school board, excuse me. And it ended up changing, or did I have it right the first time? Yes, anyways. it ended up changing on a floor amendment to create a student advisory board of 8 student representatives to the State Board of Education. We think this is really cool. Of course, at Voices, we're all about youth voice, youth input. So we'll be interested to see what the outcomes of this group and what changes they bring to the Board of Education. The next bill,
Allison, I just want to clarify with the state board and the local board, sorry to interrupt. Because they are sometimes different entities. And we do think there are some local school divisions that also have student representatives or student advisory groups. This would add a student advisory group to the State Board of Education, which is that entity that is appointed by the governor and acts on state education policies. So hopefully there can be some alignment or representation of other student voices who serve on those local school boards too.
Thanks, Emily.
Sure.
House Bill 1197 is something that folks have been talking about in the field for a while, but it will establish a work group to study what the transfer of the Department of Juvenile Justice from the Secretary of Public Safety to the Secretary of Health and Human Services. What's interesting here is it would sort of take that punitive approach that the Department of Juvenile Justice has really been working to transform themselves away from into more of the rehabilitation and treatment, mental health services that are more overseen in the Secretary of Health and Human Services scope of work. So that will be interesting to see what comes of that study, and we'll look for those recommendations. The last bill that we also took a look at was House Bill 215. This was a combination of work between Delegate Roxanne Robertson and Senate Bill 1662 with Senator Barbara Favola. This would establish a legislative school health services committee to review and provide advice to the General Assembly and other policymakers about proposals that require local school boards to offer certain health services in school settings. What we think is really interesting about this bill is sometimes there's been conversations about what could the state approach be for mental health services in school systems. There's often just not enough time in the short window during the legislative session to have these discussions in depth with members and policymakers and stakeholders. So we're glad that this committee would be established so that they could have ongoing conversations about this, look at what was working well in other states or what was working well in some communities, and take a more state approach to that work. And I'll pass it over to Emily to talk more about mental health.
Yeah, so continuing on that thread around mental health, the proposals around mental health were primarily in the budget, so they are still to be determined. The Senate budget did include the proposal to do a student mental health integration project, about $5 million per year, and that project would work between the Department of Behavioral Health and Development and local school divisions to extend funding for community-based and private clinical services and allow for further collaboration between school boards and clinical providers. So we've heard a lot about how students are struggling this year in terms of their mental health and how schools are struggling to make sure that they can meet those needs of their students. So we see this as one opportunity to meet both the needs of schools and students. There's also a proposal included in the Senate budget to ask the Behavioral Health Commission, which is now the new name for what we've called the DEEDS Commission in the past, to study approaches to student mental health and opportunities to maximize Medicaid reimbursement as we look to diversify the funding for student mental health services and ensure that it is sustained in school beyond the use of ARPA dollars or other local resources that have come to play during the pandemic. Also, around student mental health, we know the best way to ensure a strong system is to increase our reimbursement rates, particularly for Medicaid funded services and the children and families who have Medicaid. There are 3 areas that are on the table right now to increase those Medicaid reimbursement rates. The first is to extend what has been in place over the last year at a 12.5% rate increase for home and community-based services. That is a lot of what our children and families receive in terms of Medicaid reimbursement. The second is increased rates for residential treatment facilities for children and adults, but we know a lot of children, particularly in foster care system or with severe mental illness, are sometimes in the residential treatment facilities. And the finally is to increase the rates for the peer recovery specialists and family support services. This is an area that has not received a rate increase in a while, and we often hear provides very needed services to families. So we'll be looking for those items in the DMAS budget around Medicaid.
So some of the work that we have prioritized at Voice is really around equity. And so we wanted to just discuss a couple of areas in which we feel have a significant equity impact. Emily had already discussed language access in children's health, but more so around there's a significant equity impact when we don't have children health insurance on immigrant families and where we don't have language access in all areas. So those are things that you will continue to see us push as an organization over the next several years. And then there's the earned income tax credit intended for lower income families and families of color. The bills did not pass this legislative session, but it was a part of a proposal, excuse me, my words are fumbling today, was included in the governor's proposed budget. So as Emily discussed as well, tax policy really is the sticking point this legislative session. So I will expect to see more conversations around this in the coming weeks. But as far as us, we see a significant equity impact. I was just on a webinar this morning and talking about EITCs are associated with lower risk of child abuse and neglect for families, and families tend to experience significantly less stress when some of these programs are provided to families. An issue that I worked on this legislative session was around model policies for LGBTQ+ youth. There was more so, we had to do some defensive work where there were model policies put in place where really great, everyone came to the table to work on these model policies. And some legislators filed some bills to walk some of these back that could end up putting LGBTQ+ youth at risk in their schools. And so we were really happy to see that those bills did not make it through this legislative session and that we were able to affirm those policies through the state. And then Emily also discussed renter-friendly policies for childcare providers. This is definitely has an equity impact, number one, because families need access to childcare. And we know that a lot of lower income families rely on in-home childcare placements, and it also provides equity for those childcare providers who are renting to be able to provide that service out of the home that they are living in. I don't know if Emily, you want to add anything to that last one? No.
Yeah.
So I know that right now it feels like everything is up in the air. We're unsure. It was a hard legislative session, but I hope that you can look at this picture of our Youth Advocacy Day and see a lot of smiling faces. You see a lot of hope for the future. And I certainly see some future lawmakers in this picture. And Jonathan from Hampton, Virginia, said this at the end of our Advocacy Day: keep going, don't ever stop, don't ever let anybody silence your voice, don't ever let you silence your voice. Understand the importance of what you do, keep pushing, because one day it will really pay off. So we leave you with the words of Jonathan. We hope that you will take action on our action alerts, keep pushing, as Jonathan says, and know that your voice makes a difference in the lives of Virginia's children. And thank you for listening today. This webinar will be available for you to share with other colleagues, so please forward the link on and don't forget to take action on those links.